The example that we have here today is a cefazolin, which is an admixture. So it has powder in the top of that bag there that you're going to have to mix. To mix it, you're going to have to scrunch down your bag and then grab the little plug that's inside and pull it out. So now that the plug is floating in the water there, you can mix the water with the powder until it becomes clear. You can take a look at the top of that container where the powder was to make sure that it's cleared out. Alright, so another thing to note on your bag here is the label, which is showing you that it's a 50 ml bag, but if you look in the bottom left hand corner, it's actually saying the volume of 50 plus the drug equals a total of 55 mils. So we'll need to note that for our programming. So go ahead at this point and hang your bag. And now our pump's been paused at this point, and we can go ahead and move forward with programming our pump. So again, to program your pump, you got to talk to the channel. So press the channel select, and if you note at the very bottom there's a button for secondary. Click secondary, and you're going to choose from the list of drugs here, finding cefazolin. So you can use either the page down or use your alphabet on the right hand side, clicking the range and then the actual alphabet letter there, and then choose cefazolin. The option that we had on our bag, if you paid attention to the label, was 1 gram and 50 mils. So you're going to select that option and confirm that that is correct. Press next just to confirm that the 1 gram and 50 mils is correct. At this point, you're going to make sure that your secondary is unclamped, is one of the things that the blue banner is telling you. If you wanted to change that volume to be infused to be 55 mils, you can go ahead and click the VTBI and punch in 55 mils to match what the bag says. It's going to recalculate the rate for you, and you can at this point hit start. If you note the marquee, it's going at 110, and it's scrolling across the actual drug. And if we pan up to take a look at our secondary, we want to watch that secondary for a total of 3 drops before we leave the patient's room. And there's the 3rd drop.